So I'm going to stabilize this leg, and we're just going to stretch like this. Okay. Until she starts to feel, do you feel a bit of tension? Okay. But it shouldn't be painful. So we take it to the point where the person first notices tension. Okay, we're going to hold that for 30. And then we're bringing it back. Okay, we're going to repeat that 6 or 8 times.
Where was the origin and insertion again?
The origin is on the pelvis, and the insertion is just above the knee on the medial aspect. When you're doing this, always think about how you can position the patient. It makes it easier for you. Okay? So, pectoralis, where does it originate from? Along your sternum, right? It's got a huge origin. It originates from this part of your sternum, right? Plus a few of the ribs. Okay? And then it all narrows down and attaches to the front of your shoulder. So it's this big muscle on the front of your chest. When it contracts, the action is horizontal adduction, right? Is the action of the muscle. So when it contracts, it's going to pull Melissa's arm across her body, right? So that's the action of the muscle. Just like the action of the adductors is to bring your leg in. Okay? So again, we're moving against the action, the normal action of the muscle. So what we're going to do is we're going to drop her arm gently over the side, okay, until she feels that stretch. And again, we're going to hold it for about 30 seconds. So we're off in about a 45-degree angle, right? Because that's going to stretch the fibers that run across this way. When you release the muscle, release it nice and slowly. So it's not like an elastic band. You just don't just pull it and let it go all of a sudden. Because there can be discomfort, right, when you release. So try to release slowly. Bring the stretch on slowly. Okay. And I can feel, like even doing this a little bit, right, we're getting greater range. The chances are if I did this 6 or 8 times, you'd feel like, I could do this all day and it wouldn't get more. It's as much as you can get on that occasion. You're going to put the bottom of your feet together.
The butterfly.
Exactly. And have the person push down. Gently.
Oh my God.
Yeah. So that's a self-stretch that she can do for her adductors. Something you can send her home with, right? If we go into this position, okay, starting to feel it down the arm. Okay. Now I've got 2 ways to ease that. I can ease the elbow, okay, and the stretch is going to be more on the shoulder then, or I can ease the wrist. But to put her in this position is stretching her median nerve. It's not really stretching effects. We're going to ease off until it just eases off. That's good. And then just lift your head and put it to the right. That's going to bring it on a bit more because now she's stretching from the neck, right? She's stretching that median nerve even more. Okay, so and this doesn't occur on her right side. So just something to be aware that you're not only stretching, think about you're stretching nerves as well when you do this. So when we're stretching a muscle, but we're also stretching joints, we're stretching nerves, we're stretching blood vessels, right? So some of the symptoms people have are going to be from that. Vastus, medialis, lateralis, and intermedius, all we have to do is flex the knee. Okay, but that's a stretch for the 3 of the 4 components of the quadriceps. To stretch the rectus femoris, which crosses the front of the hip, what do you think we have to do? We have to extend the hip in some way. Because it's a 2-joint muscle, we have to stretch it over both joints. Okay. The other way we can do it, oops, I'm going to bend your knee here. Right. So against my body. And here I think you're probably feeling a bit more stretch, right? Mm-hmm. So here, this is for rectus femoris. Okay. What exercise would we give? Easiest way, just take your hand, grab onto your ankle. Okay. Stand back. Yeah, keep your hip forward and extend your hip. This leg we might want to bend up a bit just for stability. That would be a stretch. Okay. The common runner stretch. You see people doing this, right? The big thing is that you don't want people to bend forward. That just takes the stretch off. You don't want them to abduct their leg. You want them to keep their thighs together, stay upright, but extend their hip. And I am pretty tight in here. Because soleus starts, because soleus starts below the knee, right? we don't have to have the knee straight. We can have the knee bent. Okay? And then what we're going to do is we're going to stretch soleus. Okay. So that's a stretch for soleus, which is a deep muscle. Okay, it's probably a tonic muscle. With gastrocs, starts above the knee. Okay, combines with soleus to form the Achilles tendon, right? So for that, we have to keep the knee straight, and that's a stretch for gastrocs. Okay, so gastrocs is one of those two joint muscles. Okay, we've got to stretch it over the knee and the ankle. Soleus is a one joint muscle. We only have to stretch it over the ankle. This would be stretching the external rotators because I'm internally rotating. Internal rotators? Go external. We're going to externally rotate. Okay. And then just trying to come up with some exercises for that, right? For internal rotation, or to internally rotate and stretch the external rotators, we could put the leg across, take your hand, put it up there. Now we're not only going to stretch the rotators, we're also going to stretch the abductors, right? Because it's adducting. But that's going to stretch the rotators. And have them stretch this way. That would be a self-stretch, right? For upper trapezius. Okay. Or you can have the person put their hands behind their back. Do that. Just something to keep the shoulder from doing this, right? To stretch it manually, just have you lay on your back for a sec. This is where you want to know if somebody's got any serious neck problems, okay? Because you don't want to be doing this if they've got whiplash or something like that. But what I'm going to do is I'm going to side flex the head away, put the shoulder down. That's going to be a stretch for upper trapezius. I just thought I would put in a neck muscle here because we've talked about the extremity. You feel that stretch?
Yeah, it's good.
And then relax. So I'm going to stretch the left side. So I'm just moving, I'm actually moving I'm moving the origin away from the insertion, but I'm also moving the insertion away from the origin. Right? I'm kind of stretching both ends that way. If somebody is really tight, okay, or they've just had a whiplash or something, they can stretch their neck by bringing it to that side and slide your hand down the bed. Okay, so here, they're going to be stretching their upper trapezius, right? They're moving origin away from the insertion. Okay. Okay, so the IT band, people have probably heard of IT band syndrome, iliotibial band syndrome. There's a thick ligament, basically, or fascia that runs down the side of your leg. As it gets to the knee, it becomes thin to almost like a ligament, and it attaches below the head of the fibula. So runners sometimes, as they're running, if their IT band is tight, there's a frictional inflammation thing as they flex their knee. So they get this IT band syndrome. The muscle, this is a case where the muscle is small and the tendon's big. Okay, tensor fascia lata is the muscle that's involved. There's a muscle called tensor fascia lata. It attaches to the IT band, and its main function is just to keep tension in the IT band. And then, of course, this ligament or fascia comes down. Okay, so the tensor fascia lata is a synergist for hip abduction. So what do you think you'd have to do to stretch it? You have to adduct. So let's say with Richard it's his left IT band or tensor fascia lata that's tight. Would look a lot like how we do range of motion.
I could turn my body too.
Yeah, yeah. You could also side flex that way, or I could support it better. But I'm going to be stretching the tensor fascia lata and the IT band doing this. The stretch for his left leg, let's say it's his left leg that's tight. Just have you stand up for a sec. I'll demonstrate and then you can do it. Okay. So you usually have somebody hold on to something. I'm going to put the left leg behind the right. Actually, and you usually have a person stretch this way. Okay. And the further they put the leg across, the more stretch they're going to have.